Hi, I'm Dr. Kelli Harding at Columbia University Medical Center. I'm joined here today with Dr. Arthur Barsky from Harvard Medical School, as well as Dr. Brian Fallon from Columbia's College of Physicians and Surgeons. This is a series of segments on hypochondriasis or health or illness worry, and this particular segment is dealing specifically with when is the doctor right? When is the doctor wrong? So I guess part of illness worry is you have a symptom, you go to see a doctor, and I guess when does it become too much? When does it become pathological in some way?
This is a tough issue, which is
Yes.
How do you know that your doctor has really done a proper evaluation?
Right.
And I have great sympathy for patients in this regard because in this day and age of modern medicine, doctors are rushed. And if you have a complicated history and the doctor only has, if you're lucky, 45 minutes to listen to your initial presentation, is there any way the doctor can really get a full and thorough understanding about your history and your problem in 45 minutes?
45 minutes is pretty good.
It's a long time. Like half an hour is more likely, or 15 minutes sometimes. It's just hard to imagine that the doctor can really do a full, thorough evaluation in that period of time, unless you have something that's classic. So if you have classic heart disease that's showing all the obvious markers, or classic multiple sclerosis, or classic lupus, or classic whatever, then those things are readily detected. But once you start getting into amorphous areas or vague symptoms or symptoms that you really experience, like joint pains, muscle pains, fatigue, cognitive issues, but nothing really jumps out that says this is a particular disease, then you're dealing with vagaries and nuance and the artistic skill in many ways of the physician in eliciting the history from you, as well as the scientific expertise and medical expertise of the physician to go through a full range of possibilities. So I think the question, how do you know that your doctor has done a good job? I would say, number one, do you know your doctor? Does the doctor know you? Is your doctor respected by his or her colleagues? If you know the doctor is well respected in the community, has a good reputation, then you should be pretty confident that this is a knowledgeable guy who has done a good job, or a knowledgeable woman by his or her patients. So that should at least give you some degree of trust. Are you the kind of person who has a hard time trusting? If you do have a hard time trusting, well, you're going to have a hard time trusting your family members, and you're going to have a hard time trusting your doctor. So if you know that you're the kind of person who has a hard time trusting, that in itself can be helpful, because then you might say, okay, I know I don't feel good after seeing this doctor, and I know that this doctor has a good reputation, and I know I particularly have a problem with trust, and so maybe it's my issue and not the doctor's issue.
So you want to evaluate your doctor and then also evaluate
yourself, because
like.
we have problems as individuals. When we go into a doctor, we have our own personal issues that we're bringing in, and our personality and style.
Yeah, I think I would add that it is absolutely crucial that you develop a trusting relationship with a physician, because until you really have that, it's impossible to make any progress. And one thing I encourage people to do is write down what your concerns are and your questions, and make sure you ask the doctor when you're there and see if the response is satisfactory. If you're concerned that you need to see a specialist as a consultation, ask the doctor why he didn't think you need to do that. If you think there's a test that should be done, ask him why he didn't do it. And if the response makes sense, then you stick with them. If it doesn't, you need to think about whether that's the appropriate match for you. There is some sorting that kind of goes on. There are some doctors who are, in fact, better with this sorts of problems than other doctors. And it's possible that you actually have a physician who's not a good match for you. It may be the world's most competent doctor, but it's not a good fit. But I think it's terribly important to have a list of the things you're concerned about and to openly acknowledge them. I don't see anything wrong with saying to the doctor, I'm somebody who's I tend to worry about my health. I'm kind of worried about the possibility that this is lupus or arthritis or multiple sclerosis. Tell the doctor and then listen to the response and see if it makes sense to you.
So ask to hear a little bit about their thinking as well.
Exactly.
So.
Exactly.
That's a great point. And I think it's also need to find a physician who understands that anxiety is a real problem and that excessive worry and hypochondriasis is a real problem. And if they understand that, then they'll be more empathic with you. And for example, if you're going in for a dreaded physical exam because you're terrified of what the results are going to show, this particular doctor may be aware of that, and he may schedule you sooner for that test so you don't have to wait weeks before you get that test. The physician may very well call you at home with the results of that test because he knows or she knows that you're going to be worrying out of your mind until you get those results. So finding a doctor who can work with you and help you with your hypochondriacal concerns and not order too many tests when you don't need them can be a really helpful thing.
Maybe this might be a good point or a good time to talk about, what are some of the disorders that are missed by doctors? You did mention that, a lot of times doctors are sort of have their ears tuned for classic textbook presentations of cases, but I imagine that there's some things that sort of fall through the cracks of that.
Well, I mean, there are a number of diseases that early signs might be missed or doctors don't think of. Hepatitis C, for example, I've read recently that 10% of the population actually carries hepatitis C, and that can cause a lot of fatigue. So you should be tested for hepatitis C if that might be a risk factor for you that you've gotten it. Celiac disease is a sort of a new autoimmune problem, which it's like an allergy to wheat. And people with celiac disease can certainly develop a lot of gastric problems, but not only gastric problems, they can develop arthritic problems, they can develop cognitive problems, mood problems. So a lot of things that you wouldn't think would have anything to do with what you're eating, actually, in the case of celiac disease, could. And there's a simple blood test, or if you really want to, if the physician is really concerned, they may do a endoscopy and biopsy, but that can be helpful to evaluate that. Lyme disease I happen to know a lot about, which is an infectious disease that in its classic form is easy to identify. A person presents with a big round rash, or they may have a swollen joint or a cranial nerve palsy. It's very easy to recognize those as possible symptoms of Lyme disease if you live in the Northeast or the Midwest or other places where the tick is prevalent. But what might be missed is if you have fatigue and cognitive issues that don't really jump out and say Lyme disease, because clearly fatigue and cognitive issues can be stress, or it could be depression, much more commonly than Lyme disease, but sometimes it could be Lyme disease. So finding someone who's knowledgeable about different problems can be helpful. Vitamin B12 deficiency can cause numbness and tingling, for example, and if you do a vitamin B12 test, sometimes that's not enough, and other tests need to be done to really assess whether there's a vitamin B12 deficiency. Thyroid disease can cause fatigue. I'm not trying to create hypochondriacs by telling you about all the diseases that you might have that have been missed, but really just to say that you want a physician who's done a reasonable and a good evaluation. And as Dr. Barsky was saying, if you've gone to a physician and you're not satisfied, get a good recommendation for a second physician. If, again, you're not satisfied, then you might think that maybe it's you and not the doctor.
And also when it sounds like you're reassured, you receive some reassurance from the doctor, but it maybe helps temporarily or doesn't help at all, and then it starts interfering with other aspects of your life, or that's when you might start thinking that maybe this is something more in the anxiety spectrum, such as hypochondriasis.
Yeah, have I ever had this before and it went away? Have I ever had it before and it turned out to be nothing serious? There are lots of things you can do to reflect back to get some sort of calibration about how likely it is that this is something really serious. How chronic is it? I mean, things that last a long time and don't get worse tend to be relatively benign. The bad stuff we tend to know it starts to evolve. And
that's true. And also it sounds like thinking of, and I think you mentioned this in another segment, the common things first. Have I been more stressed out recently? Could there be another reason for my symptoms? And those. Okay, well, with that, I think we'll go ahead and conclude. There's more information on our websites. If you're in the Boston area and are interested in participating in a research study, there's the HealthStudy.com. And if you're here in New York, we have the illnessworry.cumc.columbia.edu.